discuss some of the questions that come in to the clinic. So this thing of where pain is felt and where the cause is coming from is a topic that keeps on coming up. And as people, we naturally focus on where it hurts. For example, if your neck is hurting, then one tends to want to massage the neck or take care of the neck. However, what one sees in practice is, especially when pain is constant, very often the source is coming from a much deeper tension line. So if pain is there, no matter what you're doing, whether you're moving or not moving, then there's a deep inherent tension line in the body, and it's on the core muscles and not the localized area. So say, for example, with neck pain, very often it's on the same side of the body, but it's much lower in the bigger muscles, either in the abdomen or coming up the chest, that we end up releasing to help that constant aspect. And once we can get the constant aspect to this, then you can start looking at, okay, if I move this way, it hurts on this side or it hurts the opposite side. And then you together those pieces of it. It's a little like undoing a Rubik's Cube. You have to start from the basis. Very often shoulder pain that's constant is coming from the hip. And some people can get frustrated, the shoulder pain, and we're wanting to start from the hip. Sometimes it takes half the visit just to convince a person that, yes, that's what we need to do. So that part of it is it's not common sense, and it's not taught generally in school or in any kind of information that you see in other places. So this information is really pretty novel and new. It's only been around about 15 years, which is embryonic in anything medical. The medical wheels, they turn so slowly. I had a patient ask today, why isn't this medical school? Very good question. Um, I think that would be the best option, be to train family practitioners so that at that first visit, when pain is established, that treating and then ordering the test, but that treatment starts immediate. Obviously, we don't have the hands or the amount of doctors that are trained yet. So, yeah, so this concept of working together, muscles working together, things antagonize each other. When, for example, this area that's really complaint is the area between the shoulder blades. A raise of hands, how many of you have felt a burning pain between the shoulder? Very common issue. And with modern day lifestyles that we have, with our arms always on keyboards and on things pretty close to us in front of screens or holding devices, the pec muscles can really start tightening, and these stabilizing muscles underneath the arm really tighten, and they pull shoulder blades forward. And then the little muscles between the shoulder blades can't actually take it. They get so strained and tired. And so very often we end up treating the pec muscles and the muscles underneath the arms. So yeah, modern day lifestyle plays a bit of that. Just going to see there's a message chat. Let me just start from the top. Okay. All right. Pain. Okay. So, Lauren asked about ideas about painkillers, why they don't work and what might work. Opiates, question mark. So, painkillers, two fronts for the most part. They work in the brain to tell, okay, don't worry about it. What you're feeling is try and de-escalate um, how much information is being brought to the forefront. It's not a solution to the problem. The other thing is that the other components like Advil, anti-inflammatories, basically the site of irritation, inflammation, but very often the pain that we feel is tension. And when we're feeling tension pain, go along the same pathways in the brain as the normal C fibers, the pain receptors. So subduing the C fibers doesn't make any difference in pain. As you who know, who take opiates and strong painkillers, when a muscle is tight or cramping or in spasm, nothing touches it because a different kind of sensation, and it bypasses where these medications work. Opiates are dangerous because of how much they cause addiction and dependence. And they can often treat one component, can get really reliant on them, and it's really, really get off them. But when it comes to tension and myofascial distortion, these painkillers really don't work. Muscle relaxers can help take the edge off sometimes, but I also find them hugely ineffective. If you don't find the source of what's making that glute or that back muscle spasm, you're stuck with it keeping in spasm and being triggered by the amount of movement. You have to where that imbalance is happening, in my experience, is what really gives you a solution and is not. So honestly, yeah, the pharmacology side of things has not really given us a whole lot of good options when it comes to pain and tension-based, especially. Dan has asked, why is omega-3 and magnesium important? Omega is important for so many functions, for brain function, eye function, how things glide over one another, how cells work inherently. So we often are low on omega-3 because people don't eat enough avocados, oily fish. And this can be an access problem, and it could be the Western diet. And so one finds that very often people end up dry eye later in life, but every single cell needs omega-3. And you find that there's these combinations of 3, 6, and 9. And with the grains that we eat, you find people have almost an overdose of 6 and 9. But the omega-3 component is the that keeps cells and helps them to function well. And so it helps to counteract the effects of inflammation. So that's why omega-3 is really important for general health, but also for inflammatory changes. Magnesium is really important, and there's a number of types. So you get ones that stabilize stomach function, that help bowel motility, but you get magnesium bisglycinate, which really helps with muscle stability. So if you're struggling with cramp at night, with muscle tension at night, then magnesium really is something that can help with getting things to relax a bit. It also settles the nerve system. So these are supplements that can be helpful, and we do talk about it in detail in the free section in the free material in app if you wanted to go into more depth with that. Marita has said that she's been trying to manage bursitis in her hip for a year. Shockwave therapy has been tried, injection from an orthopedic surgeon, not much relief. Any thoughts? Okay, so often when I treat bursitis, I'm looking for tightness over and around that bursa. A bursa is like a little cushion that sits between the hip joint and the muscular, and very often I will gives the biggest relief is releasing the musculature over that bursa so that there's not as much compression. Because every time you walk, these things are rubbing and causing friction over the bursa. And then when you sleep, you put tension on that muscle, which then compresses the whole system even more. And so from our perspective, we would treat where we find tightness of the musculature that's running over. So that can be from the glutes down into tensor fascia lata, down into the IT band, anywhere that whole line is often the one causing that problem. Sometimes you have to look at the opposite side, because if you have really tight left-hand side in this line, the right side will tighten up in response, balance you out when you walk. And so often treating one side isn't enough. You have to treat the other side. And often people with bursitis will find that they get it on one and then they start getting it on the side. X-rays really don't about the soft tissues, so they often don't provide the answers that we want. Shockwave can help sometimes, and especially if there's a calcific tendonitis areas that can break that down. But I find often just releasing the musculature, and my suspicion is that sometimes when you get these cortisone injections into actually release the muscle over it, doing that procedure, which is part of what gives that relief. Okay, Wendy's asked, how do I use my massage gun? So this is a huge topic. I think I need a more specific question. Because we go through this quite a lot in the app also on how to use the massage gun. So say, for example, you were targeting a muscle group. First, you need to identify where you need to treat, and that's really the key factor or method, and our proprietary information comes from is the system of testing. So if you've done the 5 tests, say now, for example, for the lower back, and you say, okay, where I need to treat side of my body, you're going to spend about 2 minutes on that area. If you put your massage gun on, choose a frequency in the mid range, try it on your leg, it's comfortable, and you let it, then leave it like that. If you want to experiment, you can take the frequencies down a bit, it goes a bit slower, and up a bit where it goes faster. For each person, frequency is pretty individual what they like. It's like asking a person, what color is your foot? These frequencies feel different to different people. Some people tolerate a lower frequency and others really enjoy the high frequencies. So find where on the setting on your machine you feel, oh, that feels nice. And then on a muscle group, it's about 2 minutes. And in doing that, if you're going up and down the muscle, not to push hard, the weight of the machine often quite enough. Very minimal pressure is needed. You don't need to hurt this. And if you then for a tight spot, then just spend about 30 seconds on that tight spot. Don't kill it or annihilate it. You're just trying to get to release a little bit, and it need a little more work tomorrow. So um, one does have to be patient with that a little bit. Um, so yes, thank you, Beverly, for that answer. Yeah, so we do give a number of in the app about how to use the gun. Areas that you want to are in the neck. The massage guns, I don't like to one because in quite a different price range. And what I've seen though lately is that they're all kind of gravitating towards this $100. So even the ones that are expensive, like the Rainbow, it's come down to around $100, which is quite nice that they are becoming more competitive with each other. Wants a deep enough vibration. So you want to see that you get about a centimeter or 10 millimeters of vibration depth. Because if it's just a very fine buzz, you're not going to get that reflex to fire in the muscle. You want that little jerk in or little hammer effect on that muscle to make that fire, which the muscles release and give you an effective change. The other the gun is that you've got a short time period. I find that the longer something has been, harder it is to get it up because of the inflammatory start happening and the thing in fascial tissues. So if you when going and you can feel that you're tight and sore, you get the gun on the right area with or two. You don't want to leave for weeks and then try and sort it out because you're going to then struggle and you might end up really needing the needles. So to try and catch things quickly, but when you do, that can be hugely effective and you can clear things out as they happen and not be stuck with things escalating. So yeah, so I used Motion Gray. That's a Canadian-based company. They're based in Richmond. And with Hydra gun, with expensive one, I don't find that they're any different. So I don't see the need these guns if you've got enough percussive depth to spend a whole lot of money. And the Theragun I know that they were one of the gold standards and mainstays, but the triangular shape makes it really hard to work on yourself around your shoulder blades. So I prefer the 90-degree angle long handle. So you can reach most places with that. And we show you in the app because sometimes just turning it upside down to be able to reach back can stop you from forting too much or hurting your shoulder. So you want to take that. You do get also fancy ones that have heating and cooling in them, which is also fine. If you like heating or cooling, they can be really nice. They do often cost a bit. So you have to decide what's your budget. And then also find one that's not too heavy for you. So yeah, to try them out. And just keep it or not, because they will often say that you need to return within 3 days if you want out. So just to remember that. These companies are pretty good about refunding and returning. So the next question was, can myoactivation help with osteoarthritis? This is a broad question. So obviously or maybe it's not so obvious, but if you have a very degenerated knee, say from osteoarthritis, I am not going to needle that joint. And needling that joint is not going to make any difference. However, if the IT band is tight, then instead of the knee can you see, being straight on itself, it's now being to this angle. And so now you get accelerated degeneration on some of the aspects of the knee. So if you can balance that knee out, very often you'll find that the knee feels better, there's more space in it, not as compressed, and the inflammation reduces. So what happens in clinic is that we will treat patients with severe osteoarthritis, and while if they go have an X-ray, that joint still looks awful. They're actually moving with minimal pain and are pretty functional. So I think arthritis does not always equal severe pain, because I have seen in so many cases that we do X-rays of the knee compared to these asymptomatic is not the one that is degenerated. It's the strangest thing. Sometimes minimal change on X-ray is severe pain, and extreme change, they walk, it's wobbly and it's noisy. When you bend, you can hear it creaking, but it's actually not painful. So often if you can get some space in the area and get the inflammation to back off, then pain can be reduced even though it's awful. We have some more questions in the chat. So I hope that answered your question about myoactivation and osteoarthritis. So yeah, so I do think we help with osteoarthritis. We don't necessarily reform the joint. However, we do increase functionality. It has the osteoarthritis and reduce pain. I've seen that consistently. Why would I have back and pain only when sleeping? It wakes you up. It goes away as you get up. So there could be a number of this. It could be the sleeping posture is putting pressure on the exact places where it's high tension. So very often this can be side sleeping. I don't know how you sleep, however, but if there's a lot of tension in the band and in the lateral line, then when you sleep on it, that joint presses on these exact tension lines. And so then it ramps up that pain. And also then the distraction of your movement and your day-to-day activities is not there. So now the only thing that the brain is focusing on is that pain and tension. So yeah, so that is often why we become more aware when things are quiet and the lights are off, and now your body is really just focusing on internal sensations rather than the external. So that gets more focus, and also when there's pressure on areas under tension, then that will ramp that pain up as well, and it will wake people up. This is often tension type pain that does this because the painkillers really don't touch that. Can you describe the difference between the apps? One time, monthly? Could a one app teach us what we need to know about how to manage our case? Why would we need a monthly app? Well, this is really an individual thing. And so the app is created so that firstly, the first month is there for you to trial it and see what all is covered so that you have a mental idea, okay, that's what I can do with it. And then people will sign on for a month or two to treat specific areas. Say now it's the lower back. The information doesn't change. So after a while, you get to know it. Very often, a 1 month just focusing on an area, you'll get to know the test, get to know where to treat for those tests, and then you won't need to sign on every time or to pay for another month. You can sign on as a subscriber or desubscribe from your profile. And then later, if it's you've been, for example, and now your knee's hurting, then you can sign again for a month and get access to body part and learn that area and treat your knee, for example, for that while. So very often patients will sign on for a month or two at a time to learn about an area, to treat that area, and then they'll sign off when they're feeling good and won't be needing it. Could a one teach us? So you could just use the free month and do a cheat sheet if you and just use that for the future. That's an option. But there are a lot of body area. So the total amount of tests I think is 67 currently that we have in the app when you include the wrist and the ankle and the neck and areas to treat for migraine. So there's a lot in there. It took me a number of years to learn all of it. So it's there for so that if something starts to hurt, you can see, can I fix this at home? It's an option for you. It's just an it was really to create something so that people something to use at home and not trend and now dependent on the chiro, massage therapist, physiotherapist, acupuncturist. It escalates and escalates, and sometimes patients come in and they've got 3 or 4 different appointments in a week, and it's just finally it's exorbitant what that does to a person. Okay, so Emily has raised a hand. Want to ask a question?
Yeah. So you talk about hypermobility and needling. You don't want to do it super often. When the massage gun isn't getting rid of how long should I to come in to get needled, typically?
If you've tried 2 or 3 times to get something to release and it's really not responding, then call and make an appointment. And if you're in a 7, 8, 9 kind of pain, then ask for cancellation appointment so we can get you in earlier.
Oh,
Usually we can get you in within a week or two
sweet.
if it's urgent. Okay. Are there any other questions that you wanted to ask live? Okay, otherwise I'll keep going down the list. Okay, Lauren, I'm hoping um, that answered your question. I don't know. So part of the question was, can you describe the difference between the apps? So there's not really. Oh, and so there's two um, categories of the app that we have. I don't know of other apps that actually teach people the same information. I have not seen any other apps that actually do what ours does with the system. So I can't do other apps at this, but so there's a basic level, and so that is $14.99 for the months that you use it, and that has the whole body's testing system in it. So if all you're wanting to do is test and treat, then that's got all of it in there. The premium is $29.99, I think. And so that gives you in addition, so it's got the whole body's testing system, but it also has a daily trackers for the supplements that are helpful with chronic myofascial pain, as well as habits, things like how much did you walk today? How much did you sleep? How much um, did you take your supplements? The food-based things like vegetables in focus, trying to get wheat that's been processed a whole lot out of your because of how inflammatory it is. So there's a tracker for multiple things that help to get a person out of that vortex of pain. If you are sitting and you're feeling like you're really getting sucked into it and you want to see what creates relief and you're wanting to track those things, then that level give that functionality where you can every day go on and track, and then you can pull graphs and you can see when I did my symptoms were like this. So you can track all the symptoms and you can track all the habits and then try and figure out, okay, this really works for me and this is the biggest change, so that it gives you that information. It's something where you can print tracker and take it to your provider and say, okay, these are how my symptoms have been tracking over the last 3 months, and this is what I've been doing, so that it gives them a real data background of what you're dealing with and how much you're trying to do, which, we're in a day and age where, especially, you're all women here, so I can say this. Um, but when you have a male practitioner, and I hate even saying this out loud, but when you have a male practitioner and a woman comes in with a complaint, you will always somehow be seen as being a little hysterical, over the top, complaining too much, or just a lot to deal with. And really irks me to beyond. But when you have hard data to say, okay, this is what I've been tracking, this is what I've been doing, it makes it harder to argue with, to say, okay, we're not going to do any special investigations. Then you kind of can push the hand. Even with referrals to our clinic, I have patients who say that, my sister came and I did a referral and my practitioner refused. What in the world is happening here, Um, there's low risk to kind of treatment. There's no chemical usage, that, so many factors. But yeah, the premium level gives you the access to that tracker so that you can do that if that's the space that you're in. And then we have also the Zoom calls that we add to that. And there's a community where people ask questions, and the questions that come up, we then do some research and questions in that community for the different body areas where people have asked those questions. So if you go into the community in that premium one, you'll see there's a list of articles that you can click on, and you can see the past articles that we've researched and answered questions on. So that information, some of these are frequently asked questions about shoulder pain or ankle pain, or what shoes to wear and that kind of thing. So that's the difference between uh, the basic and the premium. And then there's a yearly, which gives you a bit of a discount if you know that you usually for different body areas. So this can be useful for someone with something like fibromyalgia, where the pain is always shifting around to different areas. That makes it a bit more effective. And then there's a lifetime membership that I think is about the cost of 2 years, but then it gives you a lifetime of, if you know that you're using it frequent different body areas, then that's more cost effective. So it's really just about budget and where you're at and how much support you're needing, slot into the different options that are available. What can I say about numbness of the hand without pain? This can be complex. Often there's a nerve root that's being pinched. Sometimes we find that we can help with it if the nerve root is being pinched tight muscle, because it happen where muscle is actually down over a nerve and cutting off its blood, especially in certain positions, then releasing these muscles can really help that sensation to return. Very often it's been labeled as a neuropathy. Things like carpal tunnel sometimes need seeing the musculature in and over the carpal tunnel can um, be really helpful. Um, Numbness in the hand, pain. Yeah. So I would suggest a number of things. Firstly, to get a referral for needling because that's the one we can see if we can figure that out. The app will also give you places to treat where you can see if you can release it at home and get that sensation to improve. At the same time, if there's a referral being done to us, I'll also get a referral to a neurologist for an EMG study to see is this carpal tunnel and is the function being affected, which would end up needing a surgical solution. So I would get both of those in place because the waiting time for us is about 3 to 4 months now for a new referral. And the neurologist is probably about a year and a half. So I would do both of them at the same time so that the ones in the background, if we solve the problem, you can cancel the other one. But there is waiting in the background if we don't end up solving it. So hedging the, the different things. Why is needling for hypermobility? So people who are hypermobile, the risk of needling is that we don't actually want more mobility around a joint. You just want to create balance and some between the different movements and the different joints. And for example, with the shoulder, with mobile people, they can practically touch their hands behind them. And this can cause them to have more risk of dislocation in their shoulders. So we really don't want to loosen things up around these joints even more. The connective tissues holding the joint together are already too elastic. The musculature helping to keep things together. And so we don't want the muscle letting go of everything. So we do tend to stick with hypermobility, and we're just looking for where there's asymmetry, where one side doesn't match the other side. We try and get them functioning the same, um, but not getting more and more and more range because we don't want to increase that instability. Hope that answers that question. And then somebody had their hand raised. Who was that? Catherine, do you want to ask the question?
Yeah, you can call me.
Kathy?
I saw you about a week ago, or a week and a half, I don't remember, for pain in my upper right arm,
Mm-hmm.
which sort of went away for a day or two, and
Okay.
then it's back um, more and worse now.
Okay.
And
So,
I have an appointment with you at the end of August. But,
okay. So you can call on Monday and see, or Tuesday, because Monday's a public holiday, see if we can get you in on a cancellation and see if we can reduce that again. Sometimes there's an antagonist that's still active. So the things that have gotten strained now relax, but the antagonist is still working. And so then it sets up the whole chain again. And so it is a complex thing to figure all of that. It's not always a simple fact that it went away for 2 days, though, is a positive prognostic sign that this isn't an osteophyte or an infection. There's not another medical reason other than it's in the myofascial system. So possibly we can fix it. But it also often means that things are coming from further away than what we were looking to go even further.
hmm. Also, you worked on my neck and shoulders, and I was able to stand up with my shoulders down for the first time I noticed in a long time, and that was great.
Nice. So the other thing about that, when you see such a big postural change, is also to note of our daily posture. Because what we're doing on the daily basis, say now one enjoys sitting reading and you're holding the book up here and you're kind of in this posture, and one ends up getting stuck there for a couple of hours a day, that particular could be what sets up this whole tension line. So if things released well for 2 days and they come back, the other component is really looking, okay, what was I doing? I stuck in a posture? Was I doing something repetitive that could really get my tissues stuck in that posture and shortened, especially with the pecs being so prone to shortening and tightening and pulling the whole shoulder, carriage and chest forward. It's something you really have to be mindful of to move enough in the day that just set in as a habit. So the habits that we do have, we also have to look at. If something released well and your whole posture changes, then that's something that might also, and we might need to change habits that you're in and how you distribute the time in your day to maintain that result for longer.
I'm a big reader.
Somehow I felt reading was somewhere in there, but yeah. Yeah. So, when you're getting growth in a book, it's hard to put it down.
It is.
And yeah, and getting your brain to focus on the book and to focus on movement is impossible. We claim that as women we're really good at multitasking. We are to some degree, but actually also we little help. And so if you have a book that you're getting engrossed in, you need an external timer to remind you to move. Otherwise you won't. And you could end up being there for 3 hours and tomorrow you're going to be sore. And there's no amount of needling that I can do that prevents that. So that has to change as well. So sometimes an egg hammer is a good idea because it's the kind of sound that you can't ignore. It's not just the vibration on your wrist that you can kind of know away. So something that makes you get up and move half an hour to break that cycle might be something you might need to do.
Okay, thank you. I will call for an earlier appointment though.
All right. Okay, let's see if we had any questions in the chat. Okay, that was okay. I've had nerve numbness since 2019. Should I be asking my doctor to see a neurologist or is it too late? I don't think it's ever too late. I think it's worthwhile pursuing an answer for that. If it's sciatica, L5 is one kind of area around the lower back needs to be looked. I had high pain all of 2019. So interesting to know where that pain was. Was it in the back, in the leg? Because compression of a nerve for a long time can make that nerve permanently damaged. Unfortunately, this is reality, so one does want to get top of it as possible. So yeah, if there's numbness, that sometimes we can get that away. If it stays L5, okay. It stays and it was because of a herniated disc. That might be permanent nerve damage in that nerve root. However, of all the things that one keeps from these kind of onslaughts to our body, having a numb patch is probably one of the better outcomes. Sometimes we can, but sometimes it does need the disc, that part of the disc that's herniated onto to be shaved away. Big difference. When it's been that long, then you're probably going to be stuck with a numb patch on your leg. Unfortunately, but this is something that people deal with in the long term, and especially here in Canada where surgeries happen so long after the injury, often won't be recovered. Grace has asked, are needles good for sciatica? Actually, yeah, you spelled that actually perfectly. So yes, I see a lot of sciatica, and for the majority of them, we can create a lot of relief because sciatica very often is something that has got multiple components. Very often there's the nerve is coming out of the spine, and there's compression there. But if it can floss through all the other tissues, very often symptomatic, even though on an X-ray or on a CT or MRI, you can see that there's compression at nerve root. But if it flosses through all the other tissues, through the glutes and down the leg, then it's not so much of a symptomatic problem. It's when there's another point on that nerve that's also getting compressed. And now you have this stretch effect or this tension in the actual nerve. And then it starts to send signals all the way that you interpret as the whole leg. You can feel it all the way down to the outside of your foot. And so very often, if we can release the tract where it's running through, if we can find where there's tightness, either in the glutes, around the piriformis muscle, because sometimes the sciatic runs through fibers of piriformis muscle and not over it. The quadratus femoris muscle too can sometimes be like around that nerve. Very often, if we can release these nerves or release the muscle around the nerve so that the nerve can floss through, then having that one point symptoms anymore. So we see many people get a lot of relief sciatica. It's not some guarantee, if it's on the nerve too much in the back, it needs surgery. But a huge percentage of people, we find that they come in and say, "Oh, my sciatica's gone." So it's something we consistently see on a weekly basis. So I look for the second place where that nerve is getting compressed. If we can find it, at least a person can a lot more ease and be a lot more symptom free. I hope that answers your question. Any other questions come? Is anybody using the app and having a question around the app's usage? Um, Lily, you want to ask it?
Sometimes the app will like bug out. Is there a way we can like, I don't know, record it on an external device or like save the videos that we use most often for the back or something?
I've had patients do that. I would really appreciate it if you could send me an email and let me know which videos are doing. So what I find that it often has very much to do with your own Wi-Fi, like our own Wi-Fi in the scenario where we are, the place where we are, and our connectivity. Because I've had a person in South Africa say, "Oh, it was bugging out," but when he used a different device, it was fine. So the videos can sometimes be quite large, and some of the devices don't have enough RAM on them to actually handle the whole package at a time. So it is a difficult thing. Try to keep the videos as short as possible so that it doesn't do that. But you can only get so short to keep formative. This is a difficult thing when people are on different devices and their Wi-Fi speeds are at different levels. Um, yeah, it is a little bit of a quagmire that quite how to solve. And sometimes in testing, then you'll find that it takes before the video properly downloads and then starts to play. And especially if it's a longer, it just means giving the device a time to be able to download it and be able to from your Wi-Fi. It
Okay.
also depends on how much people are using the Wi-Fi around you. If it's times, then everything slows down, especially when you're downloading and streaming a video.
Makes sense.
So yeah, these are challenges in the ages we live in, but we also all don't want to be living next to towers that are raiding us. So yeah, finding that balance.
That makes sense. Thank you.
Yeah. Lone, you had a question?
Oh, yes. Um,
Oh, you've just muted yourself. Hang on 1 second.
Mute. Okay, yes. Is that me?
Yeah.
I was just wondering about the supplements. You mentioned omega-3 and magnesium, which I guess I was wondering how much we should take of each, and should it be daily, and are there other things that you would recommend?
So yeah, have you been on the app?
No, no, I haven't, but
Oh,
I think I will, in fact. And that would be the $29 version, I think, with the information about supplements.
no, that's in the free material.
Oh,
The
okay.
moment you've logged in with your username and password, you will have
Right.
access to the free material. So all of the stuff about supplements, about stretches, about care after treatment, all of that is free information. Omega-3 is a very broad spectrum of dosage for different people. So for people with dry, it means you've got shortage probably in your whole body omega-3. And so then you're talking about 4,000 milligrams.
Oh,
The problem with omega-3s is those capsules are big. It's not such an easy thing to take, and they're usually in 500 milligrams, sometimes 1,000 milligrams per capsule. And so to swallow four of these things or eight of these things in the morning is not easy. So I think part of the limiting factor there is your ability to not gag when you take big capsules. Um, but
well, I
omega-3,
use the oil. I use the Norwegian fish oil,
okay. Whew.
which,
I tried that. I could not manage it. So well done on you. But yeah, there's no toxic level. Your body can use about as much of that as you can take. So, as much as if you can take a tablespoon at least every day, that's absolutely wonderful. The magnesium is usually around 400 to 500 milligrams at night. Just
uh,
before bed is often the best, the glycinate. But there's different kinds. So you don't want to take the one that right before bed. So make sure it's glycinate, not citrate. Just yeah, so that you've got the right one. But it does settle the nervous system down, makes the muscles relax. Then vitamin D3 is really important if you're living north of San Francisco. We don't get enough here in the right frequency to make effective amounts of D3, even if you go in the sun for an hour a day.
mm,
We don't get the right frequency of light. So, and I don't know why, but they fund testing of vitamin D in Canada. You have to pay extra. It's like $40. But I have yet to test a patient who's not on vitamin D3 supplementation here in Canada and not find them deficient. But D3 is really important. Take that as a supplement for your calcium absorption. And we also see osteoporosis, which I think is also a natural condition of that deficiency for people living here. The other thing is K2. If you're
yeah,
taking D3 and calcium, you need to take K2. K2 stops them from getting stuck on the tendons and in your arteries because artery hardening is a big risk factor for your vascular problems.
yeah,
So we want to get the calcium off the artery and off the tendons where they cause crystals and cause pain, and you want it put into your bones and teeth and structures that need the calcium. So very often the D3 and K2 will come in preparations together. They make them together. Very often you'll find D3, K2 together. And they're oil framed supplements. So to take it with your biggest meal of the days when it's best absorbed.
yes, I do take D2 and D3, but I don't take them together. I guess but
But you could. They don't work against each other. They work with each other.
yeah,
Yeah.
thank you. No,
You're
that's
welcome.
informative. Mhm.
Um, okay. After do you ever advise strengthening exercises? Absolutely. Strengthening is so important, not only just for general health, but for functionality in your day, for keeping independence, so important. So in the first four appointments that we do, we're doing them pretty quickly on needs recovery time. So in the first four appointments that we do, we ask that people not do strengthening right then, because if things have been stuck for years and you release it, you don't want it fully contracted straight after release. After the first four, when your appointments are about a month or longer apart, then we want to bring in swing again. And this is where the physiotherapy section of allied health becomes really useful, because if one can go for an assessment to see where are the weaknesses, where can build up really helpful, and they can give you a program and you can follow up maybe once a month to see, okay, where is strengthening needed, and adapt that program as you build more stamina. That can be really great. So it's really after the first 4 appointments are done, then we start encouraging people, okay, let's get back into strengthening, into the activities you're wanting to do, so we get that stamina back. To start low and go slow, not just slam your body. If you do a strength training kind of work and you're older than 35, you need a day of rest in between your strength training. You need a day of recovery in between, so that can rebuild, they can repair micro tears, more and more fibrosis in the muscles as you go. So that's about strengthening, absolutely, but not in the first 4 appointments if you're coming into the clinic. With the massage gun, you don't need the same amount of downtime. So if you strain the muscle today and you release today, obviously that particular muscle tomorrow hard, but 2 days you can start doing your workout again where you're. Would it be possible to do my daily routine now of exercising and walking in 5? Go for it, Grace. You're fine. Nobody, if you need to go, you can go. We're about finished anyway. We're at about time. So anybody who needs to leave, please don't, I'm not going to think you're rude if you leave. So K2, vitamin K2, yes.
I have a question.
K2, yes.
I know what the app has so much choice on the app.
So Kathy, if you go onto our website, so it's a web app. It's not on Google and Play Store, because then the cost would be a lot more. So it's a web app. So if you go on our website, myoclinic.ca,
Okay.
you'll see right on the top it says myoMassage app. You just click on there, it will take you through the app.
Thank
So
you.
it's a specific link on the website, but it is made in a way so that it will adjust to whatever screen. So you can use it on your phone with the same login as on your iPad or tablet. It will reshape itself so that it fits that particular screen, so that you can use it on any device.
Thank you very much.
You're welcome. Okay, let me just see here. Hi, Bobby. Thank you. Awesome. Nice. You can, yeah, enjoy the rest of your weekend. And Beth, thanks for that's great. Okay, everyone, we're going to be off now. I hope that will, and a nice long weekend. I hope something fun planned. It's a bit rainy, but it looks like it's clearing. So that's good. You that are in Victoria. Yeah, it was lovely to see your faces. We ended up having about 28 people come today, which is amazing. Yeah. Right. Any other questions? Okay, so hang on for Susie. Oh, for Susie, what you can also do is Instagram. We also put information on there, the vitamins, or you can just get the free material in the app. We do have dosages in there. Okay, everybody, have a lovely weekend.
Very much.
Thank you
Bye.
so much.